Are we to beginning? Yeah. Hey everyone, welcome to our webinar. So today we're going to be talking about understanding the motor vehicle accident process, powered by human integrated performance. So in today's webinar, we will be going over a couple of things, including some true and false, what you do, what we do, and then we have a review at the end and some frequently asked questions. So today's presentation, there's going to be Sarah, our physiotherapist, and myself, Mina, kinesiologist, and Sophia, our kinesiologist student. So our first question is, if you don't go for treatment right after an MVA, will I be denied treatment? And the answer is false. You are able to access funding for up to 2 years after your accident. Your primary healthcare provider has to submit a report within the first 2 years of your accident, then you should be approved. So our next question is, will my coverage only allow me to see one provider per day? The answer is also false. So you are able to see multiple providers in the same day. Many patients prefer to have different appointments on the same day. It all depends on what you and your provider's schedules are like. So our last true and false question, my auto insurance will give disability payments if I can't work as a result of an MVA. And that is true. So depending on your wage, you could make up to $600 per week or 80% of your average gross weekly earnings.
Hey guys, it's Sophia. So first up, we'll be talking about what steps you must take after getting into a motor vehicle accident. So you get into an accident. What do you do first? First up, it's important to collect the other driver's information. This includes getting their insurance and driver's license information. If anyone is seriously injured, it's also important to call emergency services right away. Lastly, you should file a police report. This can be done if the police came to the site of the accident or by you going to the police station afterwards. Now, after the accident, what should you do now? If you're seriously injured in an accident, it's important to go to the emergency room or urgent care to see a physician. If your injuries don't require you to go to the hospital, it's still recommended you go see your family doctor sometime after the accident. To begin the process, get approval for treatment, you must first submit an AB1 form to your auto insurance. It's very important that you don't skip this step, as you are the one responsible for this and may not receive any treatment without a completed form. Once you've received notice that this has been approved, you're all set to start booking your appointments.
Hi, it's Sarah. So we're just going to talk a bit about what we as a clinic do for you after you have a motor vehicle accident. So we do 4 different things for you at the clinic. We'll do an assessment, we'll get your approval for treatment, we'll treat you, and then we'll discharge you when you're better. When you show up to your first appointment at the clinic, your physio or chiro will perform an initial assessment. They'll start off by asking you a couple of questions about what happened at the accident, how you're feeling, and what your symptoms are. And then they'll perform a physical assessment to see what's going on. And then we come up to a conclusion about what your injuries are, give you a diagnosis, and go over a treatment plan with you. We'll also teach you some exercises and send you a home exercise program to get started on. The clinic will also get approval for your treatment to start from your insurance company. If you're within 90 days of your accident and you've used less than 21 treatments, you're considered in protocol. So you should be automatically approved to start your treatment. If you're outside of the 90 days from the accident or you've used more than 21 treatments already, you're considered out of protocol, and we just have to wait for approval from your adjuster to start treatment. And just a note that the clinic will communicate with your adjuster for approval and for other things too. So if you're wondering if your adjuster has approved you, you can ask the clinic. Next, we start treatment. So after you have an accident, you'll be seeing a variety of providers such as physios, kinesiologists, massage, chiropractors, and psychologists. And your treatment may include manual therapy, exercise therapy, and modalities. So you are entitled to 21 physio, chiropractor, and massage visits combined. You also have $1,000 in psychology coverage, $350 in acupuncture coverage, and $350 in massage coverage. And your physio or chiro will make a treatment plan to help you get back to your normal. If you do need visits and in addition of the 21, we can ask for more from your adjuster. We'll just have to wait for approval. And then once you're feeling all better and you've recovered from your injuries, your physio or chiro will discharge you and your treatment will be finished. Healing timelines and length of recovery processes vary depending on the person and the extent of their injuries. So because of this, treatment can continue for up to 2 years after your accident with approval. So now I'll just go through a bit of a review of what we talked about in the webinar. So what you do when you get in an accident, make sure that you exchange information with the other driver, contact your insurance company to fill out an AB1 form, and then call us to book an appointment. We will then assess and treat your injuries. We'll communicate with your adjuster for approval, and then we will decide when it's time for discharge. Your approval, if within 90 days and 21 visits, you're in protocol, should be automatically approved. And if you're more than that, you're out of protocol and we'll wait for approval. So just some frequently asked questions to finish off. The first one is, what if my accident was more than 3 months ago? Can I still get help? And the answer is yes. If you remember from the true and false, you have up to 2 years from the date of your accident to receive treatment, even if you're out of protocol. The second is, what if I'm discharged and feel like I need more help? So yeah, within that 2 years, you can always come back. And if your healthcare provider feels that your injuries have come back or you're still having symptoms and you need more treatment, we can always ask for approval for that. The third is, will you ever be denied treatment? And the clinic may turn you away if you have not yet completed the AB1 form and received approval. You also may not receive treatment for any pre-existing injuries prior to your motor vehicle accident. So if you have back pain before the accident, we're trying to get you back to your baseline back pain. As well, throughout your treatment, if you've not received approval for an extension yet, you might have to temporarily put treatment on hold until we receive approval. And the last question is, what are my options if I can't work? So yes, you can get up to $600 weekly from your accident insurance. We can also help you with modified duties or modified hours with your work if you just need to slowly get back to work when you're healing from your injuries. And last but not least, make sure that you stay connected with us. If you have any questions, you can just send us an email or call the clinic, and you can stay connected on our social media as well. Thanks.